We did a survey a while back, and a third of a clinician's working week is spent just simply creating their notes or doing their letters. The AI technology is like a white knight. It's arrived, and it really does provide clinicians with the opportunity to reduce that burden. 75% felt that it improved the patient experience, that face-to-face sort of consultation. The future going forward is for my voice to be an integral part of that process. So I can actually say, order a chest x-ray, and the clicks that I would have done happen in the background.
Welcome to the AI Ireland podcast. You're listening to Mark Kelly. I'd also like to welcome Dr. Simon Wallace, who is Chief Medical Information Officer, UK and Ireland. Thank you very much for coming on to the AI Ireland podcast today.
Well, good to see you, and thank you very much for inviting me.
So tell me a little bit about Dragon Copilot. What is it?
Well, Microsoft's Dragon Copilot is an AI clinical assistant. I look upon it as an antidote in the battle against stress and burnout that clinicians are facing so much these days. It's a single voice platform. It brings together the natural language dictation that clinicians have been using for years, combined with ambient. And by that I mean you and I would have a consultation and a clinic note would be automatically produced at the end. Those two come together, and it's underpinned with generative AI. It can be used by any healthcare professional, doesn't have to be doctors, and across the health ecosystem. What do I mean by that? It can be used in hospitals, can be used in GP surgeries, in mental health, in the community, and even in patients' homes. What does it mean for a GP, for example? So a patient would come like we are having a conversation now. I wouldn't be hunched over my keyboard trying to get down all the clinical details by typing or writing, but be fully engaged, eye-to-eye contact. And at the end, my clinical note would be automatically generated. And that results in a much healthier, much more engaging conversation with the patient.
For a lot of us, we're used to going to the hospital or the GPs, and we very much see it from our side. I'm sick, I want a solution. But there is another person involved, which is the GP or the clinician. What type of stresses do they actually build up?
Well, it's a great question. I think over the last 10 or 15 years, the admin burden that has been thrust on clinicians has increased significantly. So, for example, we did a survey a while back, and a third of a clinician's working week is spent just simply creating their notes or doing their letters.
That's crazy.
What's even worse is that over the last 10 years, that has increased by 25%, and it isn't getting any better. And what that's led to is clinicians being distracted from the engagement with their patients and just more focusing on getting those admin chores done.
You go to college for numerous amount of years, you dedicate your life. These are obviously very intelligent people, but they did not expect that their life would be administration tasks for a very, very high minority of it.
Yeah, I think it takes everyone by surprise. And unfortunately, what's happening in the clinical community is job satisfaction, that wish to have medicine as their career once they realise a lot of the working conditions is putting a lot of doctors off. So we've reached a point where the good news is the AI technology is like a white knight. It's arrived, and it really does provide clinicians with the opportunity to reduce that burden. And particularly with that younger generation of clinicians coming through, they're much more familiar with this type of technology. They use it elsewhere in their everyday life, and they're probably asking the question, why can't I use it at work? Well, Microsoft's Dragon Copilot allows that gap to be reduced between what we experience out in our everyday life with what we do at work.
So tell us a little bit about the pilot and what are some of the initial findings that we have?
So we've been going through a period of 9 months where we've been road testing the solution to look for, to make sure it's accurate, to make sure that there are no hallucinations, and by that I mean where sentences come out that actually weren't said, and seeing how it fits into clinical workflows. So in 7 hospitals involving 200 clinicians and 10,000 consultations, we've been road testing that, and we've been making improvements to that, and then testing that again with the participants. Some earlier data that we've had, we're still processing the data from this pilot, but earlier data which was from the US with 3 million consultations across 600 organizations, has really produced some encouraging results. So, for example, in operational efficiency, on average, about 5 minutes is being saved per consultation. And then when it comes to clinician wellbeing, that work-life balance side of things, 70% of those participants felt that it reduced burnout and fatigue. 62% felt they were less likely to leave their organization, which is really quite...
That's pretty dramatic,
isn't it? You know, just even the thought of wanting to leave because of the stress of what you're doing at work. And 75% felt that it improved the patient experience, you know, that face-to-face sort of consultation. When it comes to patients, they love it. All they want to have is, please involve me. Please just ask for my permission. Is it okay to do it, for example, which we did with our patients. And 93% felt that they had a better clinical consultation. And then finally, quality, which is really, really important. Because often if I'm typing my notes or writing, I might cut corners. But for the quality of the content of the note, 77% of clinicians felt that it improved the quality of the documentation. So I think a really encouraging set of numbers for this new technology.
What I love about that is it's just going after the low-hanging fruit of friction. Mm-hmm. And just taking 5 minutes, saving 5 minutes, but making it a more human experience, and where that person can actually sit up and look at you rather than busily type or kind of try to run through. So what was also interesting is you would have thought the natural thing for the AI to do would be to polish off the sentences or to kind of finesse it, but it kind of keeps it kind of verbatim. Is that does it do that?
Yeah, it's a great question. So you get 2 outputs. You get a transcript, which is that word for word verbatim conversation. That's useful to a degree, but what a clinician really wants is a summary, and that summary as if he or she had actually typed it themselves. And so what the AI is doing is it's pulling key pieces from the transcript and putting it into sections of the note that we would be creating every day. And there's a certain style as well that clinicians might have. For example, I have a more formal style, so that if I'm talking to a patient and we're talking that they coughed up blood or they were short of breath, instead of those terms being used, it would actually say hemoptysis or dyspnea, which is the clinical term I would write. So I think the trick behind getting clinical engagement is being able to provide an output that mirrors a style, mirrors a sort of a way that they are familiar with documentation.
But it's also it's quite good because you're working off a kind of a framework there as well, and it kind of guides you to the certain things that you need to come. And then when you have it, you can probably look at the next best outcomes or next best actions you need to follow through with in a logical step, and it makes it an awful lot easier when you're retrieving information or interrogating information, I would have thought. Does this go to the cloud automatically, or what happens then with the information?
Yeah, so when the consultation is complete and I stop the recording, the voice file is processed in the Azure cloud. And I think that's another important point to make is any concerns around security and that sort of thing. Microsoft, their single major priority is all around security, whatever their solution is. So this voice file is sitting in that safe, secure ecosystem.
It blows my mind that only 5% of our listeners actually subscribe to the podcast. We've got one favour to ask. Please, can you subscribe to the podcast? If you like our content, you subscribing will make a huge difference to the guests that we can get on the show and also be a voice for AI applied across Ireland, but doing it the right way. Now back to the show. One of the biggest challenges within healthcare, if you spend a little bit of time in it, is the opportunity to have one source of the truth, to try to integrate these different types of systems. And how does this plug into EPRs? What does that actually look like? How do we start to get that kind of one opportunity to have that one source of truth?
Yeah, really, really good question. I think 50% of the benefit of this technology is simply in the fact that you can create your note quickly, that you can surface information. I can interrogate the note for certain pieces of information, and it can help me with my actions if I want to prescribe a medicine of some kind. The other component is how it fits into the workflow that clinicians are already engaged with within the EPR. And we have a partnership scheme with the EPR providers where they are able to take our solution and embed it, integrate it into their system. So it meets the workflows that clinicians are already familiar with within the EPR. That's a really important piece of that jigsaw going forward.
Talk to me about guardrails. Healthcare is obviously very, very important for so many people in terms of that data. People want access to data, but you kind of touched upon security as well. How do you take consideration to guardrails, bias? What kind of thought was put into that?
Yeah, it's an area that we've spent a lot of time making sure is okay. So Dragon Copilot meets all the regulatory and clinical safety requirements that are needed within a country. And that takes quite a lot of work, actually. There has to be meeting what those local requirements are. But then when we're working with the hospitals or the healthcare organizations, that they also sign up to those regulations and clinical safety components as well.
Yeah, I think that really minimizes the risk, and people can feel an awful lot more confidence knowing that due diligence is done before. Where do you see this future of healthcare going and AI augmenting it or supporting it? Where do you see this playing out in the next kind of 3-5 years?
Yeah, well, it's again a great question to conclude on. I think we're going through a sort of a behaviour change, really, where clinicians have been very familiar with using handwriting or typing, but we're now shifting into an opportunity where I can use my voice. My voice can replace my fingers on the keyboard. So not just having a conversation like we are and a note being generated automatically, but I can use my voice within the EPR ecosystem to navigate around. Clinicians will complain about the number of clicks they have to do, for example, to order a chest x-ray or to prescribe a medicine. I think the future going forward is for my voice to be an integral part of that process. So I can actually say, order a chest x-ray, and the clicks that I would have done happen in the background, and it gets to the point where I need to verify the request, whatever it might be, and then I can sign it off. I think that's really important. The clinician still is ultimately in charge of the output, and Dragon Copilot is literally a copilot assisting the clinician in that journey.
Yeah, one of the things I'm really interested to see is you're going to have the newer breed coming through of doctors, clinicians, who I think will very, very be comfortable using kind of a ChatGPT Copilot interface. If you've ever seen any kids, they never type, it's always voice. But then you've kind of got your kind of more seasoned practitioners who know no difference, have developed these behaviors, and now they have to change. Now, I'm sure they will want to change, but they're kind of embedded. And I kind of think about how I've embedded some new kind of behaviors. And again, I'm a little bit drastic in how I've done it, right? But I'll give you two. So one is being kind of the voice to text that I use regularly myself. But what I was noticing was when I was tired, I kept going back to the keyboard, but I changed my keyboard to Mandarin. So I pretty much had no choice but actually sticking with the voice to text using some earphones, right? I know that's pretty drastic. But the second one was I was getting a lot of lower back pain. So somebody recommended I get a stand-up desk. And when I got the stand-up desk, I kept sitting down on my chair. So I took the chair out of the office. So I just have the stand-up desk, right? Yeah. So it's kind of like the burn the ships, right? Yeah. So I don't think people have to be as drastic as that. But I think it's a good point to note that if you want to change your behaviors, you're going to have to start to give some triggers to allow you to do that. And I think adoption will increase if you start to help with those kind of behavioral changes.
No, I agree. I think, unfortunately, IT in healthcare has a mixed reputation of plateauing before it should do. And what's been missing in that journey is then revisiting with an adoption program and often being at the elbow of clinicians. For that generation that you're talking about, which I'm one, they're quite tired of having seen IT and it not realizing the benefits that perhaps it should have done. But I think from what I've seen over the last 9 months, for example, just seeing the note being generated and the quality of the content of that note, there's a real wow factor. And I think that will play a significant role in a stepping stone for all healthcare professionals to embrace this technology. If it saves them time, makes their life easier, they can get to their meetings, have lunch breaks, and get home on time.
Yeah,
you know, those softer benefits are really going to speak oceans for how this technology goes.
Yeah, and I think the key thing is that get off the hamster wheel, stop tunneling and get through to today, and actually looking at the usage and then actually giving themselves a new perspective on how they can actually start to do the work that they have. Dr. Simon Wallace, Chief Medical Information Officer, United Kingdom and Ireland, thank you very much for joining us.
Pleasure, thank you for having me.
At AI Ireland, we're helping over 1 million people become literate using artificial intelligence. And we do this in a variety of different ways. The easiest way is our AI literacy program, where we do a 60 to 90 minute program via virtual Zoom or Microsoft Teams, where we teach the rules of the road of AI, from basic business concepts to ethical and resourceful decisions on how you actually use AI every day. This is our literacy foundation. The second way we use AI training is within our workshops. These are either virtual or in-person workshops where executive leaders come and use some of the AI tools that we make available for them, that they can actually start to take their own documents and reimagine savings of time and energy, but taking away friction from the work that they do each day. Later on, we actually empower different departments, HR, finance, sales, marketing, operations, and start to utilize AI across relevant use cases to upskill their different types of departments. If you're interested and ready to go on your AI journey, we'll be able to showcase over 700 applications of applied AI about how you can actually stop reinventing the wheel and start using AI for your organization today. If you want to start out and find out a little bit about the golden thread of activities that we've got to allow you to start to utilize AI straight away, please feel free to reach out to us and we'll give you a good comprehensive overview about the arts of the possible, minus the hype, purely applied. See you then.